We're here with Dr. Don Middleton. He went to Northern Arizona University, attended medical school in Los Angeles. You've been a family physician for 25 years, and for the last 7 years, you've worked out at the Meadows Behavioral Health, an internationally acclaimed center out there. Yeah. And we sure appreciate you being here and talking to us a little bit more about the issues, especially around the issue of treatment.
Yeah.
And you know, that's tough these days. There's a lot of ideas about, you know, what's available, what the options are, and pretty much every time we turn around, you know, somebody's coming up with some new novel idea about how they're going to deal with this issue of addiction and substance use disorder. So could you talk to us a little bit about just, you know, from your perspective, you know, what really are the viable treatment options that are out there?
Okay. Yeah, you know, Kim, for millennia, there was no real legitimate treatment for addiction. It wasn't until like 100 years, well, less than 100 years ago, that the guys started up AA, and they did it out of necessity, but they found something that actually could be pointed at and said, hey, this is sort of working. We have people that are enjoying long-term sobriety. But after that, then we started taking, the medical world started taking addiction a lot more seriously. And there are definitely charlatans out there trying to separate you from your money. And it's such an emotional thing that parents are willing to, you know, mortgage the house or do anything to get their kid away from it. But there's definitely better ways and worse ways to do it. Finally, the American Medical Association and some of the other groups are starting to certify certain rehabs and say these people meet certain standards that we recognize as consistent with literature and with standard practices. And then there's, you know, counselors that specialize just in addiction medicine, and psychiatrists who just do addiction medicine. You'll find in general that it's a really high penetration rate of people that have actually been addicted themselves that go into it. And it's thankfully a good thing because they have a higher level of empathy towards the problem, and it's not just a paycheck for them, it's life and death.
Yeah, so kind of being specific, you know, somebody has a loved one that's has this issue, and let's just say they're willing to go into, you know, treatment, and let's just say that it's they're really having some pretty significant issues. They've had some pretty bad consequences to their actions, and so they're ready to go. You know, what's the typical standard of care? What would be the recommended, you know, first step for somebody like that that's pretty deep into it?
You know, if the person's able to stop their drug of choice without physical complications, then they don't necessarily have to run off to rehab. A lot of people will, you know, seek some private counseling, or maybe even just go to one of the 12-step support groups, you know, whether it be Gamblers Anonymous or Overeaters or Alcoholics or Narcotics. There's a whole bunch of those anonymous groups. And they have people there that have already walked through that fire, and they got their hand out to say, here, I'll show you the path. And so that's usually a good pattern. Now, if your person that you're dealing with has alcohol or benzodiazepines, that withdrawal can kill you. Not just make you feel like you wish you were dead, but actually kill you with seizures and whatnot. And those people should be encouraged to be working with a physical, you know, medical doctor and decide, does it come to the level of needing supervised detox or whatnot. And just because you've stopped before and you didn't have a seizure doesn't mean you won't next time. There's this thing we call the kindling effect, so each time it can get worse, and the next time could kill you. So meeting up with a medical doctor to help mitigate the risks is a good idea for benzos. Now with opioids,
and
it's different.
Benzos being like
Xanax and Valium and Librium and on the street now, Xanax. It's just tons of it out there.
Yeah, so in particular, alcohol and benzodiazepines like Xanax and all that, those have a very serious potential for problems with withdrawal. So those you recommend some sort of detox for sure.
Or at least working with a doc about that. Sometimes
Okay.
they can do, like some medication at home or whatnot. But if a person has the ability to be supervised and have IVs and nausea medicine and a nurse handy, why not? Because it's safety, and you don't want to die over a few dollars.
Right. And even for individuals with other, substance addictions, so opioids and others, they can also end up in a position where, a detox or something like that is a first step.
Yeah. Now, opioids are interesting because they won't kill you when you withdraw, but they make you hurt so bad you think you're going to die. And so people, when they're not cared for properly during their detox, they'll run away and use again. And they might be scoring from a different dealer than they're used to or whatever. And nowadays, one wrong pill of fentanyl and they die. And so people with opioid detox, they don't die from the withdrawal, but they die from the relapse. And so you want to prevent them from feeling so uncomfortable that they need to go out and use again. All the others, like marijuana and stimulants and those kind of things, usually a person just needs to sleep it off for a day or two and stay hydrated, maybe multivitamins and whatnot. But those two biggies need to be at least paid attention to by a doctor.
So they get through a typical situation where they've been through a detox, they're past that stage, and then standard of care being in somebody that has a significant problem being like an inpatient treatment and that type of thing?
Frequently, it's inpatient nowadays. A lot of people want to just get detoxed and then go out, and it's what we, in the industry, we call that a spin dry, and it's really not very helpful. They typically are using in just a few days if there's not a substantial support system behind them. But yeah, going to an inpatient, and like I said, there's different ones. You look for certifications and referrals from physicians and people that are in the business. And those tend to be anywhere from 30 to 90 days of inpatient. And then often there's a step-down unit called intensive outpatient, an IOP. And that would be like where you go every day or 5 days a week for several hours and take classes and counseling and group meetings and whatnot. So it's not completely going back to life, but you may be living at your house or in a sober living facility during that time. And the idea is to slowly transfer you back to mainstream life as you build a sober world around you, because you're just not used to, going to a ball game without beer or playing golf without the golf cart lady coming by 10 times, And so it's like learning how to like have a birthday party without drugs or alcohol. And it sounds normal to most people, but for addicts, that's a lot of confusion and work on how do you even do that,
Yeah, I think one way to think about it is that treatment is not really about telling somebody don't use drugs. I mean, I think that's pretty obvious,
Yeah.
right? I think when they're in treatment, what are they really getting from it?
Yeah. Well, the first thing they're getting is they're physically separated from their drug of choice, right? It's not like they have a stash under their pillow or something. They're there, and it's a clean place. And they're not prisons. They can leave against medical advice if they want to, but the facilities do their very best to try to keep people there, keep them comfortable so that they don't feel like they're, on pins and needles, and then surround them with other people that are going through the same thing and learn to be able to speak about how they're feeling rather than just try to run away from it.
So learning those, I guess you'd call it adult coping skills, those things about how to deal with life on life's terms instead of trying to, maybe escape from dealing with it.
Yeah. Almost everybody that gets to that point is using their drug of choice, whatever it is, their behavior of choice, to soothe something in here. And they don't often have the language to say, you know what, because people say, you got a problem with alcohol, and they don't know to say, alcohol is not my problem. Alcohol is my crummy answer to my problem. My problem is I don't feel right in here. And so you take them away from that drug of choice and give them new tools like prayer and meditation and exercise and nutrition and talking to people about your feelings. And they aren't adept at doing any of those things. So for 30 or 45 days, we teach them how to do that. and then put them in a facility, in a setting where they'll do it frequently, like going to 90 AA meetings in 90 days, or that kind of thing, where they're encouraged to be with other people and talk to them and share their feelings. And it's a whole new skill set, but it can be learned, and they don't have to go back to that old treatment for this thing that's buying them. Now, it's good that they're not drinking or whatever, but if they don't find new tools, they will use something else for it. They'll go from alcohol to gambling or food or buying too much stuff off of Amazon. This won't go unscratched, all right? This will be soothed. And so you try to give them healthy tools to learn how to do it.
So I know a lot of treatment programs now will provide some sort of medication to help you, through this. So they might prescribe something that they want you to take for either a period of time, or I've even heard some people say indefinitely and things like that. So could you talk a little bit about that from a treatment perspective of why they're using, other medicines to help you through this? Not just to detox, but to kind of, get you on the right track, or in some cases, really to have a way to just keep the person maybe from potentially losing their life by using the illicit substances.
Right. Well, we use medications for detox, and we can use them to wean down off of everything. And a lot of people, at least in our facility, walk away on no meds at all. But there are drugs that we know decrease craving or decrease the ability to use, like it can block opioids, or it'll replace opioids, and it's legal, and a person's not like robbing houses or whatever to get it. But it's meant for short term, and it should be given with education, and like I said, the whole thing is trying to build a sober life around them and teach them how to adult without their old coping mechanisms.
Well, I just from my perspective and my experience, with my family, they were involved in, in treatment, and one of the aspects of that, my older son in particular, was, given medications. I think he was, in two different ones. Actually three. He was given Suboxone at one point for an extended period of time. He was on methadone for an extended period of time, and he was also given Vivitrol.
Oh, yeah.
And interestingly, those are obviously three different typical, medications that are out there that are being used, and yet, I'm not really sure, from what I've heard from people, that there's like a standard, like, how long should they be on these things versus others? And some are really saying that's all you need. Just be on that, and you don't need all this other stuff you're talking about, this supporting the person and being around them. Talk about that?
We're kind of dipping into what we call harm reduction here. And harm reduction's really important, but it gets a lot of people gets their dander up. They get some really argumentative over it. And there's two really opposing sides, like you shouldn't be taking drugs, you're just enabling them, and you're giving them one drug in exchange for another. And there's other people that are saying that people are dying and we have to do something. And it's important for us to try to understand each other here, because there is this addict stuck in the middle saying, what do I do? And a family that's saying, we don't know what's right. This is our first time through this, and hopefully last, So we use harm reduction in all kinds of things in medicine. It's just around drugs, it's so emotional, Like we use birth control pills, seat belts, improved helmets for football. Those are all harm reduction to things to keep people from hurting themselves worse than they would need to. But in medicine, we use it for all the time. Like everybody knows for type 2 diabetes, the treatment is to lose weight. You can totally cure diabetes 95% of the time if they just lose weight, which means exercise and diet. But we know that's hard. So we give them metformin and say, take this while you're exercising and dieting. And no one shames them for taking the metformin. It's just that, there's so much emotion built into the drugs The Suboxone especially, because there are, like I said, charlatans that are willing to just give it to you as long as you keep handing them cash. And they like having it go on forever and ever. We try to do it from like 6 to maybe 18 months, and as we get this person further down the line and build their sober life around them. I had difficulty with it at first as a physician too, but there was this big study in Lancet from the UK where they had all these young people, and they would give some of them Suboxone and some of them a placebo, and they couldn't even finish the trial. So many of the kids with placebo were dying because they were going out and relapsing. And it was just unethical to even keep the trial going. And we know, especially with young people, that if we can keep them from craving strong while we teach them new coping mechanisms, while we teach them to build a life and get back into the stress of school or work or whatever, we can keep them alive. Because, like I said, you don't know what you're getting off the street anymore, and one pill can put you in the grave.
And it sounds like to me the most important thing here is that you have this holistic approach. It's not just do this one thing, not just get this. It's
Right.
really surrounding this person with the resources and the help that they need to learn those skills and all of that.
Absolutely. It has to be done with compassion and with education. Now, a lot of what we see that really gets people argumentative with harm reduction is like, let's give them, clean needles or a place to shoot up or something like that. And often those things are done with, like government grants, and the government does things so lopsided sometimes. They really want to do well, but they give no money to the education or no money to the treatment. It's just to this. And so we look at that and say, that's not right. But when it's done well, it's, look, here's a clean needle, but here's things that you need to know about transmission of hepatitis and HIV and things like that. And here's a list of some treatment facilities that'll take you with no insurance, and keep doing that. Just like the doctor would say, hey, how you doing with your diabetes? You need a refill of your metformin? Sure. I want you to make sure you go meet with this dietitian and see if you can get your diet going under control, and that kind of thing. So education and harm reduction, that's the best secret sauce there for getting them off of it safely.
So when it comes down to it, having that treatment program, potentially going through multiple steps, so potentially inpatient if that's deserving of that.
Mm-hmm.
And then maybe I think I've heard of partial hospitalization, PHP,
Mm-hmm.
which is kind of a step down from that. And then you mentioned IOP, intensive outpatient, which is even a little bit, more of a step down. And then maybe sober living or someplace where, they can practice these things for a while.
Yeah.
So they've got this time. So I'm guessing that's part of it, is trying to build some time so that they can, again, go back to what you said before, build those skills so that they can actually go back to, what they want their life to be like.
Right. You want to slowly take away the restraints on them as they get more and more skilled at it. Like when my children were little, I would move their training wheels on their bike up like 1/4 of an inch every other week. Just real slowly move them up. And over time, they didn't need them anymore. But I couldn't just go and take them off one day. They would have crashed, And the same thing with this is if you're just saying, okay, you did your 30 days inpatient, have a good life, it's useless. You just wasted your 30 days.
And the same thing then applies to even going on beyond that. So that's why you recommend that they have some sort of continual follow-up, either a support group of some type. You mentioned 12-step, I believe. So something that is helpful even more long-term.
Yeah. There's people that have walked on the path ahead of you, and they're there wanting to help because they know it helps them to have service. And so it's just that we're not really good at asking for help. But once we get good at sharing our feelings and asking for help with them, there's people there willing to help.
So at the end of it, professional help is really needed when it comes down to treatment.
I don't think anybody comes to rehab the very first time they quit. You know, if you're able to quit, good on you. Quit. You know, if you're able to just to go to some meetings and or maybe a few visits with a counselor and stop, then you wouldn't be seeking professional help. You know, but it's when you try and you fail, and then you try something else and you fail, then the further more frustrated you get with your inability to control it yourself, the more likely you are to need higher levels of rehab help. Yeah.
All right. Well, thank you so much. I really appreciate it.
That's my pleasure. This is so important.
Thank you.